Okay, success with surgeons.
Yes.
Right? How do you translate that into practical applications in the hospital to really get things done?
Sure. So Twitter might be the vehicle to give them a heads up. There's this new drug-resistant infection. Here's a link to this article. And then how I see that translating to changing their behavior and prescribing of antibiotics in the hospital is when I get the culture reports every day, and we look at, here's a blood culture pathogen positive in a surgical patient, and then I go on the computer screen and they're on the right antibiotic already.
Oh, I see.
So I know they were able to apply what they learned via Twitter to real life practice.
So how fast do you get that data?
The culture data every day. I mean, it's as soon as we send a culture to the lab, once there's growth, it takes about 24 hours for the bacteria to grow in the culture bottle. And then the report, they're pumped out in real time. As soon as the culture bottle turns positive, then it goes into the computer system and you get alerts. And so it's in real time. And that's really, how we know.
How is your relationship with clinicians, with surgeons, changed over the near term with using Twitter?
So what's really fascinating is, obviously I work at Ohio State, so I know those surgeons. I don't know a lot outside of that because I'm not going to surgical conferences and that. But the power of Twitter, there's a key surgeon, John Alverdi, he's head of surgery at University of Chicago, and I grew up there and I go back there periodically. And we connected, and I had a family member actually end up in his surgical unit, and the surgeon comes in to make rounds, and I'm looking at this gentleman, Gary On, and I was like, why does he look familiar? I was like, wait a minute. And so after he was delivering some news about the family member to the rest of my family, he goes to leave the room, and I said, excuse me. I go, Gary, I'm Debbie Goff from Ohio State. We follow each other on Twitter. Oh my goodness. And it was so comforting because our family member was very sick, had cancer, and was terminal. And all of a sudden there was just this different connection because Gary, John Alverdi, we followed each other on Twitter. We already knew what we were about. And now here, those surgeons were caring for my loved one. It was just a really amazing connection. And what came of that is afterwards, they invited me to spend a day, and I talked to the whole entire surgical department about antibiotic stewardship and how to connect with surgeons and what we're doing. So that all came from Twitter.
What I'm sensing in terms of real world solutions, that there's two things that are jumping out at me. One is the articulation of data, right? There's a link, there's a paper.
Yes.
But the other one is you're building personal human relationships through electrons.
Yeah. So we follow each other, and they're very skilled surgeons. They both are real involved in microbiome research, which is fascinating.
Yeah.
So I'm not an expert in that, but now I know an expert, and I actually had Dr. Alverdi be a keynote speaker at one of our major meetings. That all came from our connection on Twitter.
When we talk about influence, and I mean, influence is important. The chief of medicine is influential.
Absolutely.
We often have two kinds of influencers. One is an out-of-network influencer, and then an in-network influencer. For example, if you buy a car, your first stop is to the manufacturer's website or to some guru who knows a lot about cars. But when you want to buy, you go to a trusted expert in your network. Maybe it's your mechanic. And I wonder, with antimicrobial stewardship, there are people now who you build relationships who become part of your internal network. And so it's changing the game a little bit because your best friend might be on the other side of the country.
They are. So I work in South Africa. And I started a mentoring program there many years ago, realizing how do you do stewardship in resource-limited countries that don't have enough healthcare providers? And the vision of the World Health Organization and that is, physicians are the healthcare providers, but there's this untapped healthcare force called pharmacists and nurses, and we're higher in numbers. But they're not infectious disease trained. They don't even have the opportunity, but I can train people. So we started this program. And I taught them how to get on Twitter, because if you email me, that dialogue goes between you and me. If you tweet to me, the dialogue goes between the world. And so I taught the South Africans to jump on Twitter. That's our best way to stay connected. And it is exploding. I mean, the world is getting on Twitter. We're connecting people within the continent of Africa into stewardship, because South Africa is much further ahead than the rest of Africa. And so, you know, I have people from Rwanda starting to connect with me, and I'm like, plug into the South African network. And so it's really an amazing vehicle that does not exist any other way. I do publish papers, but you know, low middle income countries don't have access to journals that have subscriptions. So they generally read their own internal journals, South African Journal of Infectious Disease. And you know, they're not seeing what the rest of the world is seeing. And Twitter removes all those barriers. It's really powerful.
So it's a bit of care and a bit of connection.
Yes,
Thanks, Deb.
absolutely.
Great.